Mr. Osborne. Hello there, Dr. Stevens. I don't think we've met before.
No, I've been pretty well for the last few years, and I haven't been to the surgery at all.
Good. How can I help you today then?
I think I'd like a checkup.
Okay. Any particular type of checkup, or?
It's a bit difficult. Well, really for BD, venereal disease.
Okay. Do you mind me asking if there's a particular reason why you come in today then, thinking about this?
Well, I've made a mistake, yes. I've behaved not very well, and I'm fearful of the consequences.
Okay. Do you mind if I ask a few more questions? I mean, they are, unfortunately, personal questions, so they have to be, I'm afraid, but a little bit about the sort of situation and things,
Yeah.
Would you mind?
No, please. Yeah.
Well, first of all, can I ask, are you married? Do you have a partner?
I have a partner, yes.
Okay.
Yeah.
Do you mind me asking if that's a male partner or a female partner?
It's a male partner.
Okay. And how long have you been together?
15 years, I think now. Yeah.
Now, you said there was a sort of mistake, something that happened.
Well, James was away for 3 months. He's a documentary filmmaker, and he was away for quite some time.
Yeah.
He mostly works in this country, but he was abroad for 3 months doing a shoot and so on. And I got a bit lonely and a bit brandy, I suppose. And there's gay clubs I'm going to, and I foolishly went to one, and I ended up spending the night with. I know, man. Yeah.
Okay. And do you mind me asking, did you have intercourse with him? Penetrative intercourse, was it? Was it penetrative intercourse?
Yes, it was. Yeah.
Okay. I mean, I ask because obviously there's oral sex, there's anal sex.
Yes.
No.
It was penetrative. Yes.
Okay. Do you mind me asking if you use protection at all? Do you use condoms? Okay.
It's inexcusable. I mean, I'm mature and old enough to know that that's a stupid thing to have done.
Okay.
But there you go, I did it.
And is this the first time something like this has happened?
First time, only time, yeah.
Okay. Now with James is your partner.
Yes, that's right, yeah.
Do you normally use condoms with James?
We do, yeah. Even though, as far as, I've been broken up at this point, and I'm pretty sure he has as well.
Okay. And what happened in the nightclub with this other person was, how long ago did you say it was? It was
a month ago, and James came back 2 weeks ago, and I suddenly, to be honest, I've been in denial about it, blanking it up, and I suddenly thought, this is crazy, for his sake, for our sake, I must make sure that I haven't contracted something.
Okay. And since James has been back, have you both had
Yes, we have,
since then?
but
still using
protection, because we're quite active in the anti-AIDS, HIV thing, and
Have you had any symptoms at all the past couple of weeks yourself?
No.
Have you noticed that?
No. Apart from guilt, that's the only symptoms I've had.
Sure. And the person that you actually met in the nightclub, did they have any symptoms? Were you aware of any symptoms at all?
No, I wasn't aware of any symptoms.
Okay. Now, can I ask, have you ever had any tests before? Have you ever had tests for things like HIV, particularly one? And
we both had HIV tests, it must be 12 years ago, including the early days of it, but we did, yes, and we were both clear, yeah.
Okay. And have you had any tests since then at all?
No.
Do you mind me asking, your general health, is that good?
Yeah.
Excellent. No other medical problems particularly?
No medical problems.
Okay, I know from your records, obviously, we don't see you often, but I know you're not on any medication, is that right?
That's right, yeah.
Is there anything else you take yourself?
Well, I take the odd, cod liver oil and vitamin C sort of on the onset of autumn, and that's it really, yeah.
Okay. Waterworks, are they very good? Any problems at all?
No, I haven't yet to reach the prostate age. Well, maybe I'm at the age, but so far it hasn't hit, yeah.
Now, what did you think then that we'd suggest doing, or had you got any ideas about sort of tests and things?
Well, I suppose an HIV test would be appropriate, and I don't know if you do tests for, I don't know quite what chlamydia is, but I don't know if that's transmissible that way. And then I suppose, all the ghastly syphilis, gonorrhea, NSU, they all spring to mind. I don't know if you can do a test to carry out all of them, but...
Well, certainly there are tests that can be done. I suppose the easiest way to try and do it is to coordinate all in one place and actually get all the tests done to get the results to you as soon as possible.
That would be, yeah.
what we often do with patients in your situation is we recommend getting you to be seen in one of the clinics at the hospital. It's called a GU clinic, or a genito-urinary clinic.
We used to call it the Clap Clinic. But
I think that's what it used to
move on.
Indeed,
Yes.
they have changed. They have
so
changed.
the GU Clinic.
GU clinic. I'll write that down. Actually, I've got a phone number for them as well. And what patients can do is you can actually phone up and make your own appointment to be seen there. It's all done confidentially as well, so there's nothing in your records about what's been done or said, and it all stays with them actually.
Oh, great.
They'll offer you all the tests that are available to test for all the things we've mentioned. Actually, you've covered pretty much all of them actually, and they can test for those infections. And also see you again with the results and go through it all.
That sounds excellent.
The two things also I'd probably bring into what I've said also is that the test results that you get, obviously you'll know the answers for. I would say with your partner James, obviously the safest thing to do is continue using protection at the moment until you've got the results back. They also in the clinic are very good at sort of running through who might else be at risk, passing infections on, if there were anything, to have a little think about that.
Yeah.
But I think getting the results first is the first step.
Yes, but I've got to face up to if the results are positive, I've got to confess.
This is the thing, so I think finding out as soon as we can, and then they were also very good at helping you decide what to do next, how to tell people, etc. So that's a useful part. Any other questions about that?
No, I don't think so. You just give me the phone number.
Okay. I'll give you the phone number. My one other thought, I know you mentioned the HIV testing, and that certainly is available. Now, the clinic will run through it with you, I'm very sure, but there is a little bit of a drawback with doing the HIV testing, in that in the first couple of months, in the first 3 months, sometimes the test won't be accurate enough, and they often repeat it at the 3-month mark. So I thought I might warn you of that now.
Yes, thank you. Yes,
Yeah.
I've forgotten that.
Yeah, they often will test you at this stage, but they may have to retest you. So bear that in mind. But I'm sure they will run through it and give you the information about that.
Okay.
Have you got any other sort of worries or anything else?
Great to have it off my mind after, really, yes.
Yeah.
Really great. I've just been so foolish. Then in denial, that's not the best way to do it.
Yeah,
You've been very helpful, thank you.
that's all right. Let me give you their number.
Oh, yes.
And I would give them a call as soon as you can, and so you can
I'll
arrange
do.
to see them.
Yeah. Okay.
All right.
Thanks very much indeed.
Bye-bye for now.
Bye-bye.
Bye-bye.